Yeah. So welcome to PSL Talk Show, and I am Afola Kemi. With me here today is Adebola, and we have a special guest, Amina. So Amina is a specialist and expert in mental health. And I'll just leave her to introduce herself. And yeah, Amina, over to you. Can you please introduce yourself?
All right. Good morning. Good afternoon, everyone. Sorry. Good afternoon. So I'm Amina, and I work in mental health for children and young people, basically adolescents. So that's safe to say between the ages of 12 to 17.
Okay. So we started the series on trauma, and we know that trauma is a big thing in our world today, and the UK Trauma Council actually defines trauma as a distressing event. Or it can actually be like a couple of events that are extreme or intense, and they can overwhelm people, they can overwhelm children, and it depends on the person's ability to cope, and it can result in a lasting negative impact. But
Absolutely.
then what actually we're thinking about in PSL is what causes trauma in teenagers from your own point of view and from experience. How would you actually describe trauma?
Okay, I'll say that for teenagers, they can actually experience trauma in different ways, in different forms. Trauma for teenagers could occur, especially when they have been, when they are victims, or if they were victims of any sort of abuse, maybe from childhood, or if their living circumstances are unsafe, they're unstable, if they are products of separated parents, or they've experienced some form of medical illness, maybe chronic long-term illness or neglect or what have you. So those are some of the things that could that especially cause trauma for teenagers. Now, trauma is usually it comes as a result of an extraordinarily stressful event. Whoever the individual or the victim is, it's caused by an event or a series of events, because for some people, it's not just one thing that causes their trauma, or it's not just one experience that leads to their trauma. It's a series of events that leads to it, and that it also affects, it kind of affects your sense of security, let me say, and then it causes you to somehow feel helpless, like you're almost not able to do anything about it. So any situation that causes you to become overwhelmed, or that challenges your emotional, your mental, your psychological, even your physical state, can be said to be a traumatic one, because it's quite distressing for many people who have experienced such.
And my thought would be like, what are the causes of that trauma, or how does trauma escalate?
Okay, for the causes of trauma, I would say relentless stress to start with. It could be from harassment. It could be since we're talking about teenagers, we could also consider trauma being as a result of living in a crime-ridden neighborhood. It could also be caused by a chronic medical condition. It could, I would say, break up from maybe a significant relationship. It could be a parent to child relationship. It could be sibling to sibling relationship. It could be, maybe just platonic friendship or what have you, or any other type of relationships that teenagers are known to keep. It could also occur as a result of a very disappointing, how do I put it, experience, a deeply disappointing one. So say, for example, there is something you cherish so much, and then somehow that thing is taken away from you. We process these things in different ways. So it depends on how we feel about it, what we feel about it, the emotions that we attach to it. That sometimes causes the level to which the person is affected by that incident, thereby increasing their their experience with trauma.
Okay, so now there is actually a statistics in America that says that 6 out of every 10 men and also 5 out of every 10 women experience PTSD. Now, sometimes people actually use this trauma and PTSD, sometimes they take it for each other. What do you think? Does trauma escalate to PTSD, or how does this actually move? How does this work?
I think for everyone who has had a traumatic experience, or for everyone who has been diagnosed with who has been diagnosed with a trauma related or mental related illness such as trauma, will experience some form of PTSD, no matter how little. And having PTSD is one of the most common, is one of the most common signs, is one of the most common ways by which you actually come to the realization that you've actually experienced trauma, or a significant event has caused you trauma.
Yeah. So now, from what I have learned and read, it looks like PTSD actually manifests when as human beings we grow into adulthood. So how can, parents who have kids, and sometimes is as a result, their PTSD is as a result of traumatic events that they have had before the PTSD itself. So my thoughts are, how can parents actually help mitigate traumatic events for their kids?
Okay, in doing that, for parents who have children who are found in this circumstance, I would say the first thing to do is actually recognize the signs and symptoms of trauma in your child or the teenager in question, or whoever the individual or the person involved. Now, what are these signs of trauma? For very many people, especially teenagers, they could, they could display their trauma in different ways. You could notice them being in shock. They could be in denial of what's happened. They could have mood swings. They could, I would say they could experience guilt and shame of what has happened. So guilt and shame, I would expatiate a little. In the case of individuals or persons who have been abused, let's say sexually, they might, or most times they often show signs of guilt and shame, because it's something that's really, really distressing. And that just tells us that guilt and shame is one of the signs to watch out for if you're going to identify trauma in a person. So for people who also deliver trauma-informed care, this is one of the things they often look out for. Guilt and shame is a big one. And sometimes guilt is not often pronounced. Some of them don't even voice it. So it's left to you as the trauma-informed person to actually look out for those things, and then you're able to ask informed questions or open-ended questions that would encourage the person to actually communicate, and then you can pick out the pieces and put them together to be able to identify where their trauma is coming from or what has actually caused their trauma. Other signs could also include, sorry, I have some.
Yeah, it's okay.
Yeah. So other signs and symptoms, they could have nightmares, they could experience sadness. Another big thing when it comes to trauma in teenagers is social withdrawal. Most times they often withdraw from their social relationships, from their friends, from going out, from engaging in things that they usually, what they usually engage in or what they're used to. That happens a lot of the time. You also have them, they're not able to concentrate properly as they should. You also have the, what's it called? I would say a decline. Okay, let me put it like that. Let me put it that way. A decline in their academic performance. So say for someone who's not able to concentrate, definitely in school, once your level of concentration reduces, your academic performance is most likely bound to follow. So those are some of the signs that you can pick out in people who have trauma or who have experienced one traumatic experience or the other. Now, for the parents who have children who fall into this category, in helping them, I think one of the first things we need to do is recognize that these things do happen, because trauma can happen to anyone, regardless of your age, your gender, your geographic, where you live, regardless of your sexual orientation, your ethnicity, whatever. Trauma is real. It happens, and it happens to everyday people like you and me. So the first step in helping someone who is in that position, in my opinion, is actually helping them recognize that these things exist. This person is in this situation. Don't try to dismiss their feelings. Help them to recognize that it's okay to feel this way. Then what do we do about it? That's the next stage.
I have another question, but I'll just hand over to Debola to say something right
Okay.
now.
Is it something you can outgrow? Like, can teenagers outgrow trauma? Maybe they've been experiencing it for some time, like when they were younger, and then growing up, can they outgrow it, or it just keeps on?
Okay, I would say that you can outgrow trauma. It is very possible. But because trauma comes as a result of something that you've experienced, something that has happened to you, sometimes when you're delivering trauma-informed care, it's not, some of the affected persons do not believe, or they find it hard to believe that you actually know how they feel, what they feel, and what they experience from what they're feeling. So I would also say that there is no right way to treat trauma. There might be ways that may not necessarily get you the results that you want, but there is no right way to treat trauma, because people experience trauma in different ways, in different forms. Therefore, their care or their treatment would also occur in different ways. But there are sure ways to treat trauma. There are practiced, proven, evidence-based ways by which trauma is treated and results are achieved. And going back to your question, trauma can actually be overcome. It's just that I would only say that recovery it's not an overnight thing. Recovery is not magic. It doesn't happen overnight. So while it might take someone 3 weeks, 1 month, 3 months to come over to overcome their experience with trauma, it might take other people years, with or without treatment. But for long-term, for those who don't recover on time, at some point in their lives, they will need professional help. They will need maybe medical treatment to help them overcome their trauma. But there is no, there is no overnight treatment to it. It's not overnight, it's not magic, it's not from a 0 to 100. So it's essential that people take their time when working with people who have experienced trauma, and those who are seeking help as well. It's important that they are patient, they give themselves time, they allow the emotions to come, and then they're able to do something about it, because the results take time.
Yeah. So I'm going to agree with you on that, Amina, and I was going to say something. So I understand that trauma is an event, and I would think that that event sometimes might be caused by other people, or probably as a result of one person's mistake or the other. So it can be caused by that same person experiencing it, or by another person. But then I feel like the triggers from those traumas, like maybe, so it's the triggers that can follow an adult or follow somebody from the teenage or a child up to adulthood. But then how can those triggers be managed?
Managing the triggers of trauma, first thing I'll say that triggers could come in any form. A trigger could be as a result of the environment you find yourself in. It could be as a result of the relationships you keep. It could be as a result of maybe the conversations you have with people. So knowingly or unknowingly, a trigger could occur when an affected person is having a conversation with someone, or there is some sort of, I would say, stimuli in their environment that has caused that thing. Sometimes some of the affected persons also claim that they have, they've had triggers from their immediate environment. It could come, your triggers could come from anywhere. You could be watching TV and you see something. It could be a word that someone has said. It could be a picture you've seen. It could be, maybe an experience someone has gone through and they're talking about it. Triggers could be anything for anyone. You don't know what an affected person's triggers might be. It could even be something as little as a smell. So for example, someone who has been abused, if they're used to a particular type of smell, or if they know that their abuser, if the abuser is someone you're used to or someone you've been used to in the past, I'll use, let's say, parents, for example. For someone who has, for an affected person who has experienced a distressing situation with their parents, Of course, they have been living, they may have been living with their parents from when they were children. So they're kind of used to maybe their smell, the kind of clothes they wear, the things they like. So all of these things could act as a trigger in any situation. It just depends on what triggers that person or what the circumstances of their traumatic experience has been.
And those triggers, can they be identified? Can they become a bigger issue or cause a bigger issue in a person?
I would say that if nothing is done about it, it might escalate. It might turn into something big simply because nothing is being done about it. So I'll give an example. If for a victim whose traumatic experience has been caused by, say, maybe cars, if someone, for example, if someone was involved in an accident, for example, and the person has developed a phobia for maybe crossing the road or, you know, being between cars or being in a car when someone is driving them or whatever, if they're not able to, if they struggle with bringing themselves to a place where they actually overcome the effects that that trigger can have on them, it could spiral into a bigger thing, because that would mean that for every time the person tries to cross the road or the person is in a car that maybe a fast driven car or whatever, you know, that could act as a trigger and it would definitely spiral into something bigger.
Okay.
And that's just because nothing is being done about it.
Okay. Deborah, do you want to say something about that?
Can you give some examples of what could happen if it's not taken care of, like the bigger things you mentioned, it could escalate?
Okay, if your trauma is not being treated, or if you do not seek help, it could degenerate into bigger things like mental illnesses, psychological, unstable psychological states. It could lead to a decline in your physical and your mental health. You know, it could lead to a lot of things. And I would also say that in avoiding, if for teenagers, if you want to, in helping them to avoid trauma or to mitigate the effect of trauma, I would say that there's some things that I've identified which could actually help them. So I'll say first thing, they need to learn about trauma. Learning about trauma just brings you to a place where you recognize that trauma exists. It could happen to anyone. It is not peculiar to a set of people or to someone. So when it happens, what do you do about it? You need to recognize that this has happened. I know it has affected me, or I know how I feel when I think of it. What do I want to do about it? How do I get the help that I need? Or how do I get someone to help me? You need to also encourage them to reach out to other people, because there's this saying that when you find yourself in a situation or when you have a problem, the first step you need to take, or if you take the first step by saying it to someone, speaking to someone, you've actually broken that chain, the chain of, I would say, maybe distressing situations, chain of problems. You've broken that cycle. So speaking to someone about it is the first step to getting help. So sometimes it happens that whoever you speak to, if that person is not able to help, they can maybe refer you to someone that can help, or they could seek help on your behalf. But because we're we're talking about teenagers here, it is also important to recognize, for them to recognize that you need to be able to open up to responsible people, because it may not be enough for you to speak to just anyone about it, because you could be speaking to someone and that person is not in a position to help you, or they may not be in a position to seek help on your behalf. So another thing is seeking professional help, seeking mental health care, which is available in a lot of places. Most times when you get the first, when you're able to seek primary help, it kind of blocks the more severe situations that can occur from you not seeking help. So mental health care, when you seek mental health care, it's not just about Because sometimes when people think of mental health, they're thinking, oh, I'm going to end up in the hospital. It's about maybe people who are not mentally stable, walking on the road. You know, they think of different situations that are not so pleasing, but that's not what mental health is all about. It could be speaking to someone. There are different, what's it called? We have a lot of helplines now that you could actually call, remain anonymous on the phone. Although you'll be asked some questions, but if you choose to remain anonymous, like not giving out your details, maybe your name, your address, or, you know, things that could be used to identify you, that's okay. That's perfectly all right. But there are also other, what's it called? A lot of other helplines you could call and speak to someone independently and in a private way, which would also, you know, help the person. Because let's not forget that sometimes people want help. They want to seek that help, but then there's also the other side of their trauma telling them, oh, if I'm recognized or if they know me, they probably will judge me. And that's another thing, you know, a lot of people, not just teenagers, but a lot of people who have this mental illnesses think about. They don't want to be judged. And so that's another thing. Also, it's I think they should learn engaging in physical activities, because what's it called? Engaging in physical activities has been proven to release the adrenaline and the endorphins that's what's it called, that are associated to trauma. So if you encourage in physical activities, it's something that also helps. Engaging in self-care is also very, very important. Something as little as going to the spa, getting a massage, or having your alone time, maybe sitting in a park, doing some meditation, you know, little things like that that are often overlooked. They're very, very important. People overlook them a lot because they just think, oh, it's only a walk in the park. But guess what? There are a lot of things that a walk in the park can actually do for you, because walking in the park, you're alone, you bring yourself to a state where you're in tune with nature, you're able to think properly, you're calm, you're in a calm state of mind, you can, you know, blank out your mind and focus on other things which are not related to the things that are stressing you. You understand? You could, if you could do simple exercises such as sitting down, you know, spending some time and just breathe. It's often called breathing exercises. Breathing is something we all take for granted, but trust me, it does a lot. We encourage people in therapy to also, you know, try it. Just sit down, breathe in and out, or take a deep breath, relax yourself. Don't think about anything for as little as 3 to 5 minutes, then come back to whatever it is you were doing before. Sometimes you will find out that by the time you come back to what you were doing before, you probably won't even remember it. So this is something that is also encouraged in CBT as well, which is cognitive behavioral therapy. Now, if you take as little as 5-10 minutes, distract yourself, find something else to do, by the time you finish that, if you actually help yourself to concentrate on that thing 100%, by the time you come back to what you were doing before or where you were before, you probably won't even be interested in it again. So I'll give an example. If you find yourself in a distressing situation, or you find yourself thinking or worrying about something too much, find a distracting activity to do. You could be coloring, you could listen to music, you could have a nap for about 20-30 minutes. And I think it's proven, I promise you, by the time you wake up or you're back from that distracting activity, you might not, or you most likely will not be able to give that thought the same attention you gave it before. And that's something that really helps.
Wow.
Also,
okay, yeah, continue.
Okay, so also I think, okay, this will be that, okay, I have just 2 more. So I would also say that it's important to be patient with whatever you're going through. So in CBT, there's something we say. When you find yourself having an emotional emergency, the first thing you do is stop. Stop, relax, give yourself time. Don't rush anything. Because if you stop, okay, and there's also this thing that's being said. I'm trying to remember this phrase now in CBT. Between something and response, there is a space. Between an event and your response, or between the time you experience that emotional emergency and the time you give and the time you respond to it, there is a space, and that space is where your power to choose lies. Okay, I'll try to remember how exactly the phrase is coined, but that's what it says basically.
Okay.
Between the time you experience that emotional emergency and the time you give a response to it, there is a space. And in that space, that is when you have the power to choose what you do about it. So in that space, that is where stop comes. So when you stop, take a step back, think about what has happened and what you want to do to it. So you're most likely not going to give it a negative response. But if you act immediately, you're most likely giving it a negative response, which is not going to help in any way. Now, the last one, which is, yes, the last point, which is very, I think is really, really important for teenagers, is avoiding negative coping ways, because we all have our escape routes when we feel these things. Let's be honest with ourselves.
Okay.
We have our ways of coping with these feelings. We have our ways of escaping from reality when we are faced with a situation. But for teenagers, it could be as a result of peer pressure. It could be as a result of, unwholesome relationships. It could be as a result of bad advice from friends, family, whoever. So it's very important that they avoid negative coping strategies. A negative coping strategy could...
Yeah. I was going to ask what they have. We have less than 40 seconds to go.
Oh, sorry. Okay, so I'll just brush this up. A negative coping mechanism for most teenagers nowadays, they engage in self-harm, they engage in, different things. They could be smoking, drinking. So the moment you're able to tune yourself to a place where you can tell yourself, I'm not going to do this because it's not beneficial, then you're making progress.
Oh, thank you so much. I have learned a lot today, especially the breathing exercise. My smartwatch actually has a breathing exercise. And the first time I saw it under the exercise tab where you put relax and it tells you to breathe in and out, I was like, wow. And it's good that you mentioned it. So I would engage it more. Debola, just give us your concluding remarks and we can.
So I would just like to, what I could pick from this is reaching out, reach out to the right set of people and not the wrong set of people. So you don't end up doing things that would even be worse than whatever you're going through. So try to reach out, and reach out, not find an escape route, because finding an escape route means you're actually drifting away from what is going on. You're just trying to calm yourself down for that moment. So when you reach out, things would be a lot more easier.
Okay, thank you.
My concluding remarks will be that for people who have experienced one traumatic event or the other, it often happens that there's some people who have experienced these things, but they still don't understand what is happening. They don't know how much the event or the experience has caused them to experience trauma, or they're experiencing trauma, but they're not thinking of it as trauma. They just know that it's a situation or it's a feeling that they do not really like, or when they find themselves in that place or in that situation, it doesn't help them. It doesn't make them feel good in any way. So they're still not able to place it. And the only way you can actually come to that realization is in you seeking professional help. If you don't seek help, you might not even know the extent to which the trauma is affecting you. That's one thing, because for some people, they also say, oh, I'm being traumatized by this, I'm being traumatized by that. But until they seek help, they don't know how far it has affected them. They find themselves doing things that they normally would not do, but they're not relating it to that trauma, which of course it might be as a result of the trauma they're experiencing. So finally, I would say people need to, realize trauma and how it can affect them. They also need to recognize the signs of trauma, and then having a system or engaging with the system that is able to respond to that trauma situation that they are in. And they also need to find help so that they can resist re-traumatization, because it can always come back.
Yeah, sorry, I know this is a concluding remarks, but what comes to mind is, sometimes as teenagers, they find it difficult to reach out to other people, depending on the kind of trauma that they feel they are having, or the kind of events that actually happened to them. And sometimes they might not even know that it's a traumatic event. I would imagine that trauma, the event can be subjective. What causes trauma for one person might not cause for another.
Definitely.
So, and it might be a situation of their friends talk about it very often, and it's normal for their friends, but to them, it's traumatic. The experience of something, or maybe drinking or whatever, is not something that goes down to their system. So my thought is, how can that kind of a person, especially when we talk about introverts, extroverts, the way an extrovert will see something is different from the way an introvert will see something.
Absolutely.
And a teenager might not have come to that understanding that this is the kind of person I am. I might just be thinking, oh, I can't tell this person. How can that kind of person actually reach out for help?
Okay, I would say that it still boils down to the same thing. You need to speak to a trusted person. Even if you don't recognize these signs in yourself, or if you actually think there is something wrong, but you're not sure what it is, the first step is speaking to a trusted person. Now, for teenagers, just as you said, depending on what their experience or their background might be, they might not find a trusted person in their immediate environment. So what do you do? Like I said, there are helplines that can help you remain anonymous and still, reach out. I could share, maybe after the program, I could share with you some helplines, some useful helplines. So these are helplines that you can call, and we have experts, we have professionals, trauma-informed professionals who are able to help, even if it's not trauma related, then that helps you identify some other things that may be the problem. You might be thinking it's trauma and it's not. That also solves a part of the problem so that you don't focus on the wrong things. So in the case where you don't find a trusted person in your immediate environment, or you are not able to identify one, you could actually, reach out through the helplines and still remain anonymous and get the answers that you need.
Okay, that's good to know. Finally, I think mine will go to like parents. I would say that in as much as there are helplines and everything, I think, and I feel like the best support system will be for parents, parents of these teenagers. But then sometimes that's not where they get the most help. And I would say also, sometimes I would say from experience that sometimes parents kind of use the same standard or measures, especially parents that have like loads of kids. They use the same standard or measures for all their kids. Meanwhile, a child might be different from the other. So if they probably gave care in a kind of way to their first child, they're probably repeating that same form of method or care system to their second child, and that kind of a thing, and that might just go on and on. Meanwhile, the second child or the third child or the fourth child, or what I mean, no matter the number, might require a different kind of help, might need a lot more love, not because the child is disabled in any kind of way, but because they probably just need a form of more attention. And that might actually affect what is traumatic to one child to what is traumatic to the other. What can you say about this?
Okay, I would say that in the first place, a trusted person for a child may not necessarily be their parent, because think of this example for children who were brought up in unstable and unsafe homes, or for children who their parents have had one emotional problem or the other. It could be an addiction problem, it could be a drug problem, it could be their social history. So for children who find themselves in such situations, their parents may not be the best people for them to talk to. Now, it could be a sibling. Also, let's remember that as children, as teenagers, our communication styles are also different. So the way you would talk to an older sibling is different from the way you would talk to maybe a parent, for example. Do you understand? That's why it's important that as parents, we should not just be physically available, we should be emotionally available for our kids. Let's encourage them to speak to us, no matter how big or how small the issue is, especially when they're children. If you build that confidence in them, they're going to grow up with the belief that there is nothing too much for me to talk to mommy or daddy about. You know, even if they say the things that are not right, because they are children, that now helps us. It now puts us in a place to correct them and tell them, okay, this is not how it should be said. This is a better way to say it, or these are better ways to, you know, communicate to others or express yourself. And let's not be quick to dismiss children's feelings, because children catch, how do I put it? They are more in tune with their feelings and what they see us do, not just what we say to them. So if, for example, you want a child to grow up saying, oh, please may I have this, please may I have that, it's important that you reciprocate the same thing, so that it doesn't look like, oh, but when you ask me for something, you don't say please. You know, let's show them that it is normal, it's what everybody can do and what everybody should do. And that forms the bedrock of the relationship in the first place. And then that spirals to, you know, having that close emotional connection with your children, so that it gets them to a place where they can confidently and comfortably say anything to you about any situation or about anybody.
Okay. Thank you so much. And we have now come to the end of this PSL talk show. And I hope that you have learned one or two things. And I would say at this point that every link to a website that would actually inform, educate, or help you in dealing with trauma will be attached in the description box. Helplines will actually also be communicated and written in the description box. Please pay attention to them. And remember to comment, subscribe, and and follow us. Tell us what you think about trauma. If you have experienced trauma, please share, and let's also continue this conversation. Thank you so much, and bye.
Thank you.
Yeah.